I am Dr. Zakir Hussain, Senior ENT Consultant. So the topic is mid-nasal stenosis. This is a congenital condition, that is, it is seen in a newborn. So before going to the topic, let me tell you the structure of the nose first, so that you understand better. So this is a diagram of a nasal cavity, and this what happens in this condition, that is mid-nasal stenosis. Because of developmental problem, the middle part of the nasal cavity, it will be narrow, mid-nasal stenosis. So this one, the narrowing or the stenosis can be mild or it can be severe. Approximately when it is more than 50 to 70%, it becomes severe. And newborn, they are always obligatory breathers. In the sense, they know only to breathe through the nose. If there is any nasal block, they don't know, they have to open their mouth and breathe. So they totally depend upon nasal breathing only. So what happens is, soon after delivery, if there is a severe stenosis, they go into respiratory distress. If it happens to be a mild case, they will get breathing difficulty only during feeding. Otherwise, they are normal. Since they are getting breathing difficulty only during feeding, there will be failure to thrive. Now, on examination, when we try to pass in a small catheter, we will fail to pass in the catheter, and especially so, it will get stuck in the middle part. We cannot pass it on to more than 2 centimeters. When we try to do an endoscopy, we can see the stenotic part in the middle, and we will not be able to bypass that stenotic part. It will get stuck in the middle. To confirm that, we would like to take a high resolution CT scan. So if you see the CT scan, this is the posterior part, this is the anterior part. This has to be the normal width. But if you see the middle part, it is becoming narrow. So this is a case of mid-nasal stenosis. Now, the treatment, it depends upon the severity of the condition. If it is a mild case, we have to wait at least for 6 months. Meanwhile, for the 6 months, we like to do serial dilation. Why wait till 6 months? Because we have to allow the mid part of the face to grow. Because when the mid part of the face grows, at the same time, the middle part of the nose also grows and the nose becomes patent. So by the age of 6 months, a nasal obstruction may get relieved. That's why. Meantime, we can do serial dilatation and we can put in a stent too. Usually the stent is kept for 4 weeks. Serial dilatation usually will with the increasing size of the dilators. In a severe case where there is severe breathing difficulty, we like to take up the case for surgery, and with the help of an endoscope, no external scar, with an endoscope, we will drill out the middle part and make it patent. And the flap will be replaced and followed by stent placement. And stent will be kept for at least 4 to 6 weeks. So that's how we manage a case of mid-nasal stenosis. Thank you so much.